Good afternoon. Please come in. Come in. Come in. My name is Dr. Andrew Michaels, and I'm here to help you. Please sit down. No. Don't worry. Don't worry. Everything's going to be all right. You're in very safe hands here. Just getting myself situated. I was just with another patient, and we did a swab test. And we are checking for the coronavirus. I am not actually a eye, ears, throat doctor. I'm a doctor in astrobiology. But I can give the swab test, and then we can send it out to our lab on site, and the nurses will let me know before the consultation is over if you have the coronavirus or not. Does that sound good? Okay. All right, let's get you taken care of first right away here. If you'll just open up your mouth there and let me go in there. No, it's okay. I'm just going to take a quick swab on the side of your mouth. Just like that. All right, that's all. Then we just slide it into this container, and my nurse, come here, takes the swab, and we go get it tested. And then while we're doing that, we can check a few other things. Really? Let me take a look at that. Well, you know, there is a lot of misinformation out there about the coronavirus. I just need you to sign this release form for the testing. Shows that I did it, and that there you go. Good. Thank you. Can you sign here too? Right here. Very good. And you can see the misinformation just exponentially gets worse and worse whenever these diseases crop up. If you don't mind, I gotta fix my notes here a little bit. There are actually many versions of the coronavirus out there. There's not just one, there's many. I think there's up to 7, 8 right now. And some of them just cause symptoms like the common cold. Others cause respiratory illness that can potentially lead to someone losing their life. Now, these are the ones we're concerned about. The one that just recently popped up in Wuhan, China, probably came from a food source. And it was actually infecting animals, not humans. And it made the leap, the evolutionary leap, from only infecting animals to affecting human beings. I know there's a lot of people who don't believe in evolution, but they obviously never studied viruses. Well, if you've ever been sick with the flu, and you've had your flu shot, and you say, I had my flu shot, it didn't work, I got the flu. That's actually not true. What's actually happened is you've got infected by another virus or another cold. There are so many, we only do inoculations for the worst ones that we think are going to strike that year. The influenzas, stuff like that. We don't safeguard with a flu shot against every flu case. As a matter of fact, this last year I got my flu shot. My whole family did. And we traveled abroad. We were completely healthy around the holidays, not around anybody, not sharing meals with anybody, just spending normal time. The only place my daughter went was school. And guess who came home with the flu? There you go. It happens. So you never know exactly when you're... excuse me. Please don't cough. Okay. No, it's okay. Just spray a little disinfectant around and wash my hands. It's okay. No, don't be ashamed of yourself. It's all right. I just want to make sure that there's no contact between us. So if you feel like you're going to cough, please cover your face with this tissue right here. Okay. You do understand. I have to take precautions. I can't be coming down with this illness. Where does it seem to be bothering you the most? Your throat? In your throat? Okay. Now, let me check your glands real quick. Oh. Yes. Oh, your glands are swollen. Here. Let me just take a look inside your mouth hole. Could you please open your mouth hole? Your mouth, yes. And I just want to take a quick look. Oh. Oh, yeah. Oh, there's some pussy globules of infection in your throat. Let me look in the back here. Oh, yes. Lots of pussy infection and pus globules in your mouth. Your mouth hole is definitely infected. And it's going to need something. I better spray for that. I don't want to get that all over me. And your glands in your neck are... Oh, I touched my neck. Can spread just like that. I don't want to get that on my neck. Just sit still. Don't move. I don't want to get pus globules on my neck. It's okay. I think I touched my neck with the back of my glove too. And I touched the back of your... No, just sit still. Don't move. Everything's fine. No, I'm just being a little overly cautious. My eyes starting to water. Just sit still. No. Whew. Nurse, take this. It was inside his mouth. Please just throw it in the... Burn it, please. Okay. Very good. I need some cream on my hands to get that. No. It's okay. I need you to, please, just sit still. Let me look inside. Are your eyes watering? My eyes started watering like on the left side almost immediately after I touched my neck, after I touched, your eyes. Let me look. Hold still. Let me look in your eyes. Okay, your right eye looks pretty good. That eye looks pretty good. Okay, that eye looks pretty good. Alright, that eye looks pretty good. Okay. Have you had any... Was that an early symptom for your eyes to be watering early on? No? Okay. Might just be psychosomatic. Sometimes you have these psychosomatic reactions to illness when you're around somebody that's sick. You think, maybe I poked myself in the eye. I touch myself on the neck like that, and then I touch... Oh, I did it again. Oh, I gotta wash my hands. No, it's... Even... I just looked in your mouth, and that is some of the worst bags of pus I've ever seen in somebody's face. And I don't know what you've got, but I don't want it. I'm just letting you know. I know this isn't proper doctor-patient care right now, but I'm not really a doctor, and I'm not going to get that. I'm not catching that. So, open up your mouth again. Let me look. Oh, man, that is wicked. Sometimes they break open, like when you stretch your mouth, and the pus just oozes right down the back of your throat. It's amazing. I should be filming this. I really should. I could use this income from this video, because I haven't seen pus like this in ages. It's disgusting. Yeah. Well, the globules, you can tell, like, these are like runny, pussy, bloody, full of, lymph node fluid from your glands, and they're just pouring down the back of your throat and infecting your entire intestinal tract. So you're pretty much, well, I don't know what the proper medical term is, but you're pretty much fucked right now. I think that's the easiest way to say it. Yeah, you're until we get some antibiotics. We need to really get some antibiotics in you quickly. Don't worry, we have some antiviral medicines today that are really good. They give you diarrhea, projectile diarrhea. Really painful. You'll probably tear your anus from the diarrhea and bleed out your bottom, your butthole. You have your mouth hole, then you have your butthole. And when we give you these antiviral medicines and the antibiotics, there will be some bleeding, some internal bleeding, and you'll be basically shitting blood for a few days to get rid of the infection. But remember, it's good for you. It's good. This is a good thing that you're going to go through. So, that's if you have the coronavirus. I don't think, this doesn't look like the coronavirus. This looks like, I don't know what this looks like. This looks like something like a cat. If you ever see a cat that's been laying in a ditch, got hit by a car, and it's still alive, but it couldn't move, it was unconscious for 2 or 3 days, and the maggots and stuff got to its head, but it's still alive, you can bring it back. We've done it before. The cat looks fine now, but when we found it, it just had, like it would stick its tongue out, and, pus and blood and everything would just, it was horrible. You got to daub it off, and the maggots are all over. The maggots are actually eating the infection, which is a good thing. So we could get you some maggots and stick them in your mouth while you're waiting for the antiviral medication. Would that make you feel better? Okay. No? Okay. No, not the worms. Not the little maggot worms. We're talking like the fully formed with a carapace on it, a shell, like a little beetle. Those, little black maggots, and they'll just be like eating, nibbling away at the infection. You'd be amazed. You'd be amazed. They have been using this technology since ancient times, and it does stop an infection. I could get a bag of, right here, I've got a little bag here of maggots. They're just chomping at the bit here. I don't know if you'd like me to introduce them to your mouth, but no? Okay. You sure? You gotta be careful you don't swallow them until they're, you can't like, with your tongue, like, you can't take your tongue and like, roll around in there. You gotta hold still. Okay. Yeah, this is not exactly what I thought was gonna happen in this exchange. I thought we were going to discuss the coronavirus and the ramifications of getting ill. But I see that there's no reason to discuss that with you. You're pretty much, we've got to get to the bottom of whatever's going on inside you. Okay, all right. We're going to give you an injection. So my nurse is going to come in here. I'm not touching you. No. Nope. That's way above my pay grade. Honey, you're doing it. Do you want to see? Come on over here. Look here. Look over here so my nurse can see what we're talking about here. Have you ever seen anything like this before? Now look at that. Look at that. Ooh, another one opened up. Look at that. It's just oozing down the back of his throat. Good God. You are... Whoa, this is bad. This is so bad. Have you ever seen anything like that? Yeah, tell her to come in too. Wait, just hold still. Keep your mouth open. Just wait a minute. We're going to give you a shot, but we want to get it. We want to look at... Does she have her cell phone? Okay, hold still. Now look over here. Let me light it up. Okay. Got your cell phone in there? Get your cell... Just... Here, turn that way so she can stick her cell phone in your mouth. Don't touch them. Oh, you're going to have to sanitize that camera now. Get me one. Can you email it? Okay. Email me those. Okay, thanks. Okay. Does it transfer over the internet, maybe? Because I've heard of viruses in computers. Oh, those are different? Are you sure? Yeah, see, I don't know either. This iodized water, and I better not. I'm going to tell you right now, you've heard of malpractice. Well, you're going to know all about my malpractice insurance. If I catch this thing from you, you're paying. I'm suing your ass. I'll tell you that right now. This is gross. Yeah, let me put a little, I'm going to add a little cream to your throat. Now that the nurse, you're going to give them the shot? Okay. I'm just going to rub a little bit of this cream on your glands to ease the pain while the nurse gives you that shot in your ass. Well, you got to put it in the fat. And since you've got a big ass back there, we're going to put it right in there. All right. And we're going to rub along all your, let me get you a little closer here. Oh. Yeah, we want to get as much of that cream around, much of that cream in and around your glands as much as possible, because we want to relieve some of that pain. This is some really good cream. And I was instructed if somebody got their shot to rub the cream on, you know, to help ease the pain. That shot hurts really bad? Okay. Well, this should start working pretty soon, so just relax. Quit your complaining. You act like you're sick or something. Alright, so let's just make sure we get that in there. Is the pain relieving on the sore spot where you got the shot? No? Let me read this cream here again. Oh, this is butt cream. Oh, it's for where the shot area. I'm not supposed to put. I thought I was supposed to put it on the infected area to relieve pain. This is to relieve the pain down there where you got the shot. Okay, so you want to turn around and I'll rub your ass a little bit. Oh, you don't? I mean, I got it all over me. Like, I promise I'm a professional. No? Well, just a minute? Okay, turn around. Let's rub some on there then. Okay. Let's get some cream on that ass. We can squeeze a little more out. There we go. Boy, that's better. That feels better now, doesn't it? I'm glad we got to share this time together. There you go, that's good. Is the pain going away? Good. That's good. Alright. Alright, we got a shot in you, and we've got some pain reliever going on. And you can wipe that off your face with this tissue. There you go. Get it off your neck so it won't cause any more discomfort. Oh my God, that's gross. Yeah, it really is. I gotta wipe that off. Okay. I see the nurses back with the results. So we're going to get the results here. Thank you. Thank you. And let's see what you have here. Okay. Hold on a minute. I'll get to it here just a second here. I've got to sign off on it. I've got your results. It's just, I'm going to give you results here in a minute. Okay. That's strange. Oh, that's odd. Huh. Well, you definitely have an infection. We know that. But I've got some good news. You do not have the coronavirus. Is that good news? Huh? Medical science. A win for medical science. You do not have the coronavirus. Aren't you happy? So we got that, out of the way. I'm not going to catch that today. But you have something else here. You have a venereal disease that's contacted through the, through intercourse or oral sex. And in this case, it looks like you got it through oral sex, since you have it in your mouth hole and your throat. Which one? Oh, let me see. There's a technical name here. I've never heard of this before. I'm just signing off on this. You're going to need to see somebody immediately. It says, you're going to need some penicillin injections and an overnight stay. They haven't seen a case this bad in a while. They're definitely wanting you to stay here and get procedure done. You're going to need some immediate treatment. The nurse is coming in here right now. The antiviral medication won't hurt you. You're still going to get a massive load of diarrhea and the shits from what the shot we just gave you, but and it won't hurt you. But in this case, what you have is a bacterium called gonorrhea. Have you ever heard of gonorrhea? Yeah, Al Capone had it. Yeah, that's, so you're kind of like almost famous. It's kind of cool, right? Yay, I got the same thing Al Capone had. You see what I mean? It's kind of neat, isn't it? Really? You seem a little upset. Do you remember who you're with? You might want to tell them. This is something they might want to know. It's pretty grody, too. You didn't notice when you were looking down there? It was dark. Okay. All right. Okay. Was it let's see, was it like this or was it like this? Which one was it? That's too personal? Okay. Well, you never know. You never know. Nothing wrong with it either way. I mean, we could be talking to anybody right now, you're an anonymous patient here. Well, you're not so anonymous now because they're going to take you directly to the hospital after we're done and sign you in because they've never seen a case this bad in years, and they really want to get a hold of it and find out where you got it from. It's very far advanced, and it damages your cerebral cortex. It goes right inside, and it doesn't have far to travel because it's already in your mouth and down your gullet. So the gonorrhea, then it travels up into your brain cavity, and it perforates the brain tissue and turns it to jelly, basically. You just become feeble-minded, and it's pretty grisly. It's actually a horrible way to die, an absolute tremendously horrible. I'd rather get eaten by fire ants than die the way you're dying right now. So you're not dying. Let's take that back. It's because you have gonorrhea. You hear me say these words, but I really didn't say it. Yeah. You're gonna be fine. You're gonna be fine. Don't touch me. Stay back. You can only get, don't touch, Nurse, please take him away. Okay. You're gonna be fine. You're gonna be fine. Okay. There you go. It's your mental. You just think you're hearing, like butterflies are flying in front of me. You're just seeing that. I'm actually did a good job, and I saved your life. I tested you, and I saved your life. There you go. Tell them all out there, okay? Especially that real cute nurse, the one I think she's cute. I don't know. It's all on what you like, you know what I mean? Yeah. It's, I just, it's trying to impress somebody, I'm only human, Just make sure you tell everybody, I saved your life. Dr. Andrew Michaels saved my life. There you go. Very good. Okay. Let's get him out of here. Get him out of here. Get him away. Ooh, that's rough. Whew, I am going to need at least a few days off from that. That was grisly. I haven't seen, my goodness. I haven't seen pus like that in ages. Whew, boy. I hope he's okay. I gave it away. It was a he. Well, until I see all of you again, please have a most blessed day. All right? Okay. Bye-bye. Dr. Andrew Michaels signing out.